Good afternoon. I would like to thank each and every one of you for being here with us at this live session from MAHSA University, Saujanaputra campus. I am Sasi Ganesh Chinnathampi. I am the program coordinator at the Faculty of Health Sciences, MAHSA University. I will be moderating today's session. Today's webinar, Musculoskeletal Disorders in Post-COVID-19, a brief review, is proudly organized by the Faculty of Health Sciences, MAHSA University. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences at MAHSA University. Give me a few seconds. I'll be sharing my slides to brief you about the programs offered in MAHSA University, Faculty of Health Sciences. All right. Faculty of Health Sciences, MAHSA University. So we are offering various programs in Faculty of Health Sciences. All right. So I'll be going through the programs offered. Give me a second. I'll be sharing the slides. Okay, in MAHSA University, we are having the Department of Physiotherapy, Department of Medical Imaging, and Department of Environmental Health. So we have three departments in MAHSA University, Faculty of Health Sciences, and we are offering several programs under each department. So I'm sharing to you the programs, okay, offered in Faculty of Health Sciences. Okay, welcome. Faculty of Health Sciences, MAHSA University. As I informed you just now, we are having the School of Physiotherapy, Department of Environmental Health, Department of Medical Imaging. Under the School of Physiotherapy, we are offering a Diploma in Physiotherapy, Bachelor of Physiotherapy Honors, Bachelor of Physiotherapy ODL, and Master of Physiotherapy. Under the Department of Environmental Health, we are also offering Diploma in Environmental Health, Bachelor of Environmental Health and Safety, Bachelor of Environmental Health Safety in ODL mode, and also Diploma in Occupational Safety and Health. Under the Department of Medical Imaging, we are offering Diploma in Medical Imaging, Bachelor of Medical Imaging Honors, and Bachelor of Medical Imaging ODL. Okay, why you should join the Faculty of Health Sciences at MAHSA University, especially why you should prefer the health science programs. High demand for the job, low risk of job automation, okay, and you have more opportunity to work in variety of settings, and it's a career you can feel good about in your life. No boring routines, and you can get very good remuneration. Okay, let's go through the Master of Physiotherapy program offered by the School of Physiotherapy. We are offering the Master of Physiotherapy in part-time and full-time mode. The full-time is 1 year, whereas the part-time is 2 years. So the entry qualification is bachelor's degree with a CGPA of 2.50 or with a minimum of 5 years of experience with English proficiency for international students. If you need a further detail, kindly visit www.mahsa.edu.my. All right, so we are offering the bachelor programs in physiotherapy, environmental health, and medical imaging through conventional mode as well as open distance learning mode. The entry requirement will be a minimum GPA of 2.33 in two of the following subjects for matriculation and pre-university and STPM students, including biology, physics, mathematics, or chemistry. A-level, they need to have a grade D in 2 of the following subjects, which include biology, physics, mathematics, and chemistry. And for diploma students, they should have a CGPA of 2.75. Diploma programs offered in MAHSA Faculty of Health Sciences includes the Diploma in Physiotherapy, Diploma in Environmental Health, and Diploma in Medical Imaging. So entry requirements, the student should have an SPM with 5 credits, including mathematics, 1 science subject, and any other 3 subjects. Okay, and for students in O-level, they should have a pass in Bahasa Melayu or English with 5 grade C in following subjects: mathematics, 1 science subject, and any other 3 subjects. For students with a certificate, okay, certificate programs, so they also can join diploma programs in Faculty of Health Sciences. So diploma in Occupational Safety and Health, which is a 3-year program. You can go through the website for further requirements. All right. So an infinite excellence is what MAHSA aspires to provide to each of its graduates. Why you should choose Faculty of Health Science MAHSA? We are offering very good teaching and learning atmosphere in MAHSA. We have experienced and dedicated international pool of academic staff, interactive teaching sessions with both face-to-face and online platforms, and we have a list of hospitals, attachments for clinical industrial placements, and we are offering different mode of study that includes conventional, open distance, and also we have a cross-teaching experts across other departments and institutions. And most importantly, our programs are accredited by MQA and GPA with international recognition, including a dual award for program with Anglia Ruskin University from United Kingdom. The MAHSA offers scholarships including Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, and other scholarships as well. And we have several collaborations and affiliations across the country and across the international partners also. So we have World Confederation for Physical Therapy, Malaysian Physiotherapy Association, Anglia Ruskin University, and we have other partners for cross-teaching, student mobility programs, and also for our moderation of the programs running by the Faculty of Health Sciences. So we have student mobility programs, students visiting other universities, and students from other universities are also visiting our MAHSA University. So you can see the pictures. Our students have visited the lovely professional university in India. All right. So this is the University Sri Vijaya. Okay. Students visited our campus in Saujanaputra. Okay, dear viewers, if you need a further information, if you are interested to have a campus tour, kindly contact the number in the screen. I will leave the slide for a few seconds. Kindly take down the number on the screen. Our next open day at MAHSA University is on the 2nd and 3rd of October 2021 from 10 a.m. until 5 p.m. Kindly visit MAHSA. We are here to help you. We welcome you to join us. Please contact us through MAHSA website or through the faculty Facebook page to know more about our programs, or simply leave a comment. We will get back to you. Your questions concerning this webinar session can be listed in the chat box. Kindly, you can provide your questions in the chat box. Okay, let me introduce today's webinar session. All right. So as you know, we are going through this pandemic. So we have various problems caused by this pandemic, which affects our daily life. So one of the problems which we always discuss is the cardiorespiratory problems in post-COVID-19. But now today, we are going to focus on something other than the cardiorespiratory. which is a musculoskeletal problems among the post-COVID patients. Coronavirus 2019 is an emerging pandemic disease caused by severe acute respiratory syndrome coronavirus 2. Myalgias, muscle weakness, osteoporosis, and osteonecrosis are the typical sequel in individuals with moderate and severe form of this disease. Conservative rehabilitation regimens have been demonstrated to increase the functional recovery in SARS patients and other clinical illness. With this introduction to the topic, let me welcome the speaker of today's session, Dr. Arun Balasubramaniam.
Thank you.
Welcome, sir. Let me introduce about Dr. Arun Balasubramaniam. Dr. Arun Balasubramaniam was awarded the doctoral degree in physiotherapy in the year 2013 from Ramakrishna Mission Vivekananda University, Coimbatore, Tamil Nadu, India. He has more than 18 years of experience in physiotherapy field and is having organized various conferences, hands-on workshops, symposiums, seminars, and continuous professional development activities related to physiotherapy. Dr. Arun has published around 50 over research articles in national and international journals and was the reviewer for the Asian Congress on Physiotherapy in the year 2016 in Kuala Lumpur, Malaysia, and ACPT 2017 in Thailand. The screen is all yours, Dr. Arun. Welcome to today's session. Thank you.
Thank you very much, Sasi Ganesh, for giving me opportunity. Hello, Malaysia. After a long time, probably 6 years over, I am here to take a class on MAHSA students. Firstly, I would like to thank the MAHSA University Management, the TOSER, as well as the Faculty of Allied Health Sciences, the Dean, Dr. Veronica, Assistant Professor, as well as Sasi Ganesh for providing me an opportunity to present a topic. Before we'll go into this topic, I'll just share my screen over here. I'll make it as a full screen. Okay, so as I have received this topic from as recommended this topic from Mr. Sasi Ganesh, sir, can you please take a class on post COVID-19 in musculoskeletal disorders? I am a musculoskeletal therapist, as you know. I am also very interested to find out what are the possible causes seen in the musculoskeletal problems in COVID-19 because so far we are not well into the musculoskeletal part of the COVID-19 because COVID-19 we focus as he said, rightly said, it is on the pulmonary and cardiorespiratory areas. But still, we are just, I was little perplexed to identify whether is there anything happened in the musculoskeletal. And when I do a little literature study, because this is happens from 1919, that is 2019 to 2020, only 2 years. So I have did some literature study. I have also learned many things from that, which I'm going to share you in the later slides. Before going well into the slides, I'll give a brief introduction about the pulmonary disorders as well as the musculoskeletal problems. There are few conditions which is a pulmonary problem which may affect as a secondary complication like a tuberculosis of the spine. Usually the tuberculosis affects the lungs initially, that is a primary cause. Secondarily, maybe the remainings of the TB may spread to the bones or either the spinal cord or in the peripheral bones, even to the fingers, and causes damages to the bone, bone erosion, bone degeneration also happens. Even a pulmonary condition may also affect this, same as COPD, chronic obstructive pulmonary diseases. It is one of the condition when you can see there will be severe wasting of the muscles, thigh muscles, hip muscles, as well as the hand muscles also wasted. So although it is purely a respiratory problem, it may also influence the musculoskeletal part also. When we see some of the conditions like rheumatoid arthritis, polymyositis, which is a pure musculoskeletal problem. It is a system. It is a rheumatological problem, but it may also lead to a secondary problem in the heart or in the lungs or in the systemic problem like iritis is also very common. So we cannot divide the condition. It is purely pulmonary, it is purely musculoskeletal, it is purely neurological. Maybe our body has taken its integrated part, right? That's what I have learned it in this review search. We will go into the slides and we are able to identify what else is there. So COVID-19, unlike other diseases, I think every one of the here, every student will understand what is COVID-19 because we have got lot of information about the COVID-19 because of the technological advancement. We have got lot of information through WhatsApp, through the social media like a Facebook, Twitter. We have received enormous amount of information about the COVID-19. I'm not going to detail about anything extra about the COVID-19, what you have already known. The COVID-19 is predominantly respiratory illness caused by novel coronavirus SARS-CoV-2. It was first appeared in 2019 and it spread rapidly in 2020. And the World Health Organization has declared as a pandemic in 2020. Extra pulmonary involvement is I told you there are mostly pulmonary involvement is there in the COVID-19, but there are some extra pulmonary involvement is there. Since it is a premature stage, we cannot say there are so many other organs are getting affected because various researches are happening. So as a preliminary stage, as I am telling you, there are extra pulmonary involvements are there, including the musculoskeletal manifestation of the disease have become now evident. This study was conducted vigorously in 2020. Although the exact incidence, how much the extrapulmonary involvement, how much the musculoskeletal involvement is not identified. It is unclear. There are few researches happened which I am going to share you in upcoming slides. Musculoskeletal symptoms commonly seen following a COVID-19 virus are fatigue, myalgia, and arthralgia are the very common complications following the COVID-19. There is a short-term and long-term musculoskeletal manifestations are reported here. The literature, some of the literature says these are the areas which are getting affected. Some literature says there is some areas only getting affected. That was we are going to see in the coming literatures. Many of these symptoms are not severe, but they are disabling because it's not the arthritic changes which happens following COVID-19 is not devastating, but it is causing disabling because of manifesting as a fatigue, myalgia, transient arthralgia. So we are going to discuss. I'm going to discuss you. I'm going to take a brief idea about the fatigue, myalgia, and arthralgia in the next few slides. Right, there was a study conducted and it shows the prevalence of fatigue symptoms in the COVID-19 are 25.6% and arthralgia and myalgia is 15.5%. There are 8 studies reported with a higher prevalence of fatigue in more than 15% of the patients. Some of the European studies, which was conducted by Esclair and Tizia, which shows that there was a myalgia is 59% and arthralgia is 31%. Because of emerging nature of the COVID-19, the mechanistic effect of the infection of skeletal muscles are not fully understood because the COVID-19 which comes, the virus was now it is turning, it was realigning, reshaping itself. So the accurate pathology of the skeletal muscles was not identifiable. There are a lot of researches going on, but still the biological mechanism or the pathological mechanism which we are discussing or taken it from the other two conditions which resembles that. That is the SARS, severe acute respiratory syndrome. The severe acute respiratory syndrome was started in the year 2002 and then it gradually spreads. But it was not as much as spread like a COVID pandemic. It was spreaded and it was controlled well by the people, well by the WHO. As well as some of the studies also taken the pathological mechanism also similar to this is MERS, MERS, that is Middle East Respiratory Syndrome, which is also occurred in 2012 in Saudi Arabia. They were there only it was noted. It was also spread to a few parts of India as well as USA also. But it was also well controlled by WHO and the other healthcare organizations. So these two conditions was taken as a model for this COVID pandemic, and then they have described that pathology as compared with this pathology. So what we are going to see the pathology, some of the hypothetical pathologies or some of the pathologies which was related to the SARS as well as which was related to the MERS condition. And there was a mouse model of the SARS of within 4 days of infection, there was 20% decrease of the body mass was identified. There was widespread of muscle atrophy as noted, Sporadic and focal fiber necrosis and immune cell filtrations are also noted following a SARS within 4 days. This was happened in the animal model. When we look at the direct effect of coronavirus, the virus entered into the bloodstream causing myalgia, muscle loss, myasthenia, and fatigue. So when the lung, it doesn't affect only the lungs. It may also spread to the bloodstreams and causes all these symptoms. Some cases may be progressed to sarcopenia, that is loss of the muscle, or cachexia. So cachexia is noted in 5% of the COVID patients. Although there are no studies about cachexia is found out, but still cachexia is one of the common complications encountered by the COVID-19 patients, especially those who have comorbidities. And there are a lot of studies happening there. There was no published studies related to cachexia. Okay, these are direct effects. What are the indirect effects? Indirect effect of coronavirus is long-term stay in the hospital. Maybe a ventilator-assisted individual may experience muscles as well as bone fragility because of non-weight bearing. The muscles are not active. The patient was in full bedridden. The bone was not borne the weight, so the bone becomes brittle. This in turn affect the activities of daily living as well as quality of life in the individuals. When we look at the pathomechanics of the COVID-19, COVID-19 initially seen the causes coughing, dyspnea, hypoxia, respiratory failure, and sore throat. It may also causes fevers and chills. Sometimes it may causes fatigue, delirium, headaches, and encephalopathy and spasms. Because of COVID-19, which was not identifiable, but they say there is a stroke chance of getting strokes or encephalopathy are also noted. Some studies shows that chilblains, peripheral vascular disease, DVT are also common complication of the COVID-19 related to the neurological conditions. It also related to the cardiovascular conditions which causes myocarditis, myocardial infarctions, chest pain and heaviness of the chest. There is other causative factor because of COVID-19 is nausea, vomiting, diarrhea which results in cholecystitis. What we are going to see today is cachexia and the sarcopenia. The COVID-19, which causes myalgia, muscle wasting, low albumin inflammatory, and the cytokinase, with the immobilization, prolonged immobilization because of COVID-19, which may result in long-term sarcopenia, that is the wasting of the muscles. But one thing you are supposed to note is anosmia. The patient with the anosmia, that is bad smell, the patient will smell, loss of taste, anorexia, the loss of appetite. This is the indirect cause for cachexia because the patient was not able to eat properly. So because of loss of taste, because of loss of smell, so the patient was not able to eat. That may also pronounce for the muscle wasting. In addition to that, the patient may have nausea, vomiting, diarrhea, or colitis, which may also enhances or which may also avoid the patient to have the food as like as before. That may also causes cachexia. Another important thing you are supposed to note here is cytokine storm. So, because of COVID-19, it stimulates the cytokine and causes the cytokines and produces a storm. This enzyme production occurs in the COVID-19 patients. This cytokine storm may influence the muscles and pronounce muscle wasting. This muscle wasting may result in cachexia, or this muscle wasting may result in long-term sarcopenia. Right. When we look at the biological mechanism, this is one of the hypothetical mechanism. The virus infection, which causes cytokinesis as well as pro-inflammatory signaling, which results in C-reactive protein, and pathology, which causes pathological changes in the muscles. So there is a cytokine storm happening here in the virus because of virus infection. This causes a pathological changes in the muscle. When we look at the other pathological mechanism, the COVID virus stimulates the two enzymes, that is ACE2 or transparent proteinase serine, TMP or SS2 and ACE2. These two membranes enzymes are stimulated, which takes place, which happens in the synovium as well as in the muscle. When these two enzymes act on the synovium as well as in the muscle, which results in co-fusion of virus spike proteins with the host cells. You know that COVID virus, that's corona means it is the spike proteins are there in the spikes. So these spike proteins which co-fuse with the host cells, which results in virus replication. You can see this, there's double multiplication of the virus. virus getting multiplied itself. There's inflammation of the cells, cells become bigger. There's a death of the cells, cells are dead because of co-fusion of virus. The virus causes more death to the cells, as well as there is altered immune response to the cells. So the immune response of the body also happens. All these causes release of pro-inflammatory cytokine mediators. That is because of one of the reason for the cytokine storm. So this causes the cytokine mediators, release of pro-inflammatory cytokine mediators. So other pathological mechanism which was noted here is the coronavirus stimulates epithelial cell damage. Right? So it causes the epithelial cells to get damaged, and it causes dysregulation of the immune system, the altered immune system. So already it affects lungs, it spreads to the body, bloodstreams, and alters the immune system. This immune system alteration causes abnormal, exaggerated inflammatory responses. That may also result in musculoskeletal disorders because a patient have myalgia, fatigue, and arthralgia. It becomes stimulated. Sometimes the COVID virus may get affinity with the articulocartilages of the joint, especially the knee joint, hip joint, or the wrist joint. The articulocartilages of the joint, it sits there and it starts replicating. The RNA in the situ hybridization occurs, and it causes antibodies against viral protein. That also results in musculoskeletal disorder. So it is a combination of effects. We cannot say only one way of pathology over here, whereas we can say multiple causative factor for getting the musculoskeletal disorders, especially following a COVID interruptions. And this is one of the hypothetical mechanism which says, which is commonly seen in the SARS or in the MERS. The COVID virus, which affects the increase the lactate level in the body. So usually when there is a muscle activity occurs, there is increase of lactate productions. But what happens is there's a huge number of blood circulation over the active muscles, which carry away all the lactic acid. That's how we are preventing the fatigue. But here, because of COVID virus, there's increased amount of lactic acid secreted over the muscle. So increased amount of lactic acid in the muscle causes damage to the cells. So when you do exercises, the biceps which is bigger, and the blood goes to the biceps, and the biceps muscle gets enriched with the blood. But here, because of lactic acid accumulation, there is no blood circulation. It causes damage of the cells. So it doesn't causes damage of the cells. It causes oxygen carrying cells also getting disrupted. The blood was carrying lot of oxygens. Because of blood flow was reduced, because of cell damage, or because of lactate level increases, or because of COVID virus or cytokine storm, the oxygen carrying cells also get decreased or because affected. So because of these oxygen carrying cells are affected, there is a disrupted hyperlactemia. So lactic acid accumulation are increase in the muscles. When there is a huge lactic acid accumulation, there is a reduction of blood circulation, there's a reduction of oxygen carrying cells, which results in tissue hypoxia. So when there is a tissue hypoxia, then early fatigue, when you start doing minimal activities, some patients find very difficult. That's why the COVID-19 patients, when they walk for 100 meters, they feel very tired because of tissue hypoxia. The COVID virus causes accumulation of lactic acid over the muscles. The same similar pathomechanics were happened in the MERS as well as in the SARS. And very simple diagram of explaining the SARS-CoV-2, which affects pulmonary inflammation. There's a systematic inflammation, increase of toxic level or cytokine storms, which affect the skeletal system, results in myalgia, atrophy or weakness, and fatigue. This also affects the bone, causes joint arthralgias, decreased bone mineral density, osteonecrosis, that is avascular necrosis, as well as chondrolysis. Right. Sometimes neuronal demyelination has also been reported in patients with the SARS, which may also contribute to the muscle weakness as well as fatigue. So these are the common pathological mechanisms. Although it is little difficult to understand, but the mechanism which was described by the various researchers happened here. This is a common mechanism which we identified same in the SARS as well as MERS conditions. Although there are a lot of literatures and studies are going on to identify the strong relationship between the COVID-19 and the muscle loss, but as I told you, everything is premature. We cannot say that it is occurs because of this. But all these pathomechanical or pathological will support the additional muscle loss related to the COVID-19 virus. SARS infection may lead to deficit in the both muscle strength and endurance because of due to pro-inflammatory effects of viral infection, and deconditioning occurs during the convalescent period. Right. So, what are the common musculoskeletal disorders seen in the COVID-19? Soft tissue abnormalities, limb gangrene because of decreased circulation, as we saw, hypoxia. Hypoxia results in loss of circulation, which results in limb gangrene. COVID-19 toes. There are 5% of COVID-19 toes are observed here. So you can look at this picture. There's a redness occurs in the toes, in the great toe or in the little toe is observed in the COVID-19 patients. It's one of the common symptom of the COVID-19. Nowadays, they are identified it. There are hematomas are there. Pressure sores also associated with comorbidities in diabetic mellitus. So in people with a comorbidity, you are able to identify patient having coronavirus and they have diabetic hypertension comorbidities. You can find there is a limb gangrene, COVID-19 toes, hematomas and pressure sores are also very common. Presence of musculoskeletal symptoms is problematic, especially in the elderly and middle-aged population with or without comorbidities. If it is with comorbidities, it's really a problematic for the individuals because these musculoskeletal problems may aggravated in the COVID-19 virus. Soft tissues, muscles, bones, and joints, which are also involved in the COVID-19 virus. There was research supported by the Ramani et al. In 2021 stated that fatigue was 53%, joint pain was 27%, is identified. Right. So there was a long-term intake of steroids. That's one of the common problem here, which we noted is long-term intake of steroids, which is one of the common medications which are advised in the COVID-19 patients, like remdesivir injections and all, which causes reduction of the bone mineral density. There is osteoporosis or osteonecrosis is identified. There was a 55 to 58 percentage of osteonecrosis, that is an avascular necrosis seen in the SARS, especially in the areas like humeral head, talus, calcaneus, humeral head, and the knee joint. So where you can see avascular necrosis, there is a decreased circulation of the bone of the over the bone, especially over the end region, which may cause a severe pain in the patients, and the bone become very brittle. In the osteoporotic patients, because of intake of steroids, bone become very brittle. Even a mild forces, the patient will go for fractures. Right. So these are the common three musculoskeletal disorders which we are going to discuss today on arthralgia, myalgia, and chronic fatigue syndromes. Arthralgia is an important clinical complaint seen in many COVID-19 patients as well as emerging infections. This was told by HISA in 2020. But Chen et al. And Yasri has told that in Lancet study shows that there was no arthralgia noted, severe arthralgia noted in the COVID-19, although there was a mild arthralgia is noted. But there are studies or the literature or the article says that there are presence of arthralgia in COVID-19, but there was no literature has identified it. There was no strong supportive evidences. There was a study conducted by Joe et al. In Thailand. He suggested that the 2.5% of the people complains of arthralgia. And in that thing, low back pain is the common musculoskeletal disorder seen in the patient with the arthralgia. So this was done, a study done in the Thailand in 2020. Myalgia indicates general inflammation because of cytokine response. 36% of complaints of myalgia is very common in COVID-19 patients, and it lasts longer than other viral infections. Any viral infection causes myalgia, but usually the myalgia is for 1 day or 2 days or more than 3 days, not more than 3 days. But COVID-19 virus causes myalgia for longer duration, even a week or 10 days, even 1 month also patient have got severe pain, muscle pain, or muscle fatigue is also there. Because of viral infection, the patient was not able to come back to the normal life even after 3 months also. Myalgia, one of the reasons is because of tissue hypoxia. As we saw that because of lactic acid accumulation, there was decreased circulation to the muscles, and there was a decreased circulation to the muscle. The muscle was not able to remove the excess production of lactic acid. Excess production of lactic acid was not removed, which results in decreased oxygen circulation to the muscle, results in tissue hypoxia. That is also the result causes myalgia. 38% of the population suffered with the COVID-19 virus experiences muscle fatigue. There was a study conducted by Kuparo in 12,046 COVID-19 patients, he identified 25.6% of patients having fatigue. There was a study done in Hong Kong. He found out that about half, the quarter of infected patient has a post-infection fatigue syndrome. That is, when the patient do any activity or milder activity itself, patient getting severe fatigue. Like you are asking a patient to walk for 100 meters, patient find very fatigued to walk, right? So these are the common identifiable causes in the muscle fatigue. Right. There was a study done in Wuhan in 2020, and it was stated that 70% of the participants of COVID virus has got muscle fatigue. So this study was published in Lancet, and this study was conducted in Wuhan. And there was a study conducted in Iran. They found that there was 25.6% patient have muscle fatigue, and 15.5% patient have a myalgia and arthralgia. So they did a review study in the Iran, and they published in 2021, like the last year, month they have published, and they found that 25.6% is having muscle fatigue and arthralgia. There was a study conducted in Istanbul. They have did a study in 150 adults with COVID-19, and they identified the weakness in the hand grip was noted. So they have taken this patient and assessed the hand grip strength. As hand grip was, they identified that there was a weakness occurs in the hand grip. As this is similar to our COPD studies, chronic obstructive pulmonary disease, all the conditions have got severe muscle weakness, especially the quadriceps weakness is there. That's why the patient was not able to go for active walking. Even a small meter of walking may cause a severe fatigue or tiredness to the patients. Later on in COVID-19, the patient has got weakness, the thenar weakness, hypothenar muscle weakness, as well as the posterior or the extensor are also getting weakness. But still, these are preliminary studies, it was not extensively studied. And there was study conducted in Bangladesh with 90 adults with the COVID-19 individuals, the rehabilitation setup. They have done a study in Bangladesh to identify how many participants having musculoskeletal symptoms. This study was published in 2021. They identified that around 34.45 patient complaints of lower limb pain and 24.45 patient complaints of back pain. And they found 90% of patients have global weakness. In the patients who visited the rehabilitation center, or 90 patients, they identified that 90% of the patients, around 80 patients has got global weakness, only 10 patients doesn't have any weakness. They found the severity of weakness around 55.5% has moderate and 27.76% has severe severity of weakness, and only 21% has mild weakness. That is, in 90 patients, only 19 patients has got milder weakness. Other 69 patients, 61 patients, 71 patients has got moderate to severe weakness. There was a study done in Pakistan, and this study shows that the COVID-19 is an emerging culprit of inflammatory arthritis. This is a case series. This author, Muhammad Sadiq Mukram, has done a case series with the 6 cases, and he identified that all the 6 patients has got increased inflammation in their arthritic changes, the increase of the arthritis, rise of the arthritis following a COVID-19. So these arthritis patients may get infected following COVID-19. Their arthritis was increased. But this is a case study, and there was not extensive study was conducted in this inflammatory arthritis. I think need to study a lot to confirm that whether the COVID-19 has got relationship with the inflammatory arthritis. So this study was also published in 2021. And there was a study done in South Korea. They have done with 7713, that is 7,713 patients, and they identified that there was no mortality associated with COVID-19 and musculoskeletal disorders. Although the patients with the COVID-19 has got lot of steroid intakes, and the death occurs because of comorbidities, not occurs because of musculoskeletal problem. So musculoskeletal problem is not flaring up and making the patient dead, whereas the musculoskeletal problems is there, but the other problems like comorbidities like hypertension, diabetic, or stroke patients may get flared up because of coronavirus, and there will be increased mortality. So this study was done in South Korea and was published in 2021. Right. So far, the studies which we saw before related to the COVID virus, as well as related to the COVID-19 and the pathological cause, how the musculoskeletal symptoms are affected. So only three are commonly affected. One is the myalgia, fatigue, and transient arthralgia. All the three are very common seen in the patient with the COVID virus infected individuals. We are going to see who are the individuals having musculoskeletal problems without any COVID virus, because once the COVID virus was becoming a pandemic, the government all WHO has advised many countries to go for a lockdown. Strict lockdown was enforced in many countries. There was a lot of transportation loss, and the mingling of the gathering crowd as well as distancing of the social was also maintained. So, what are the musculoskeletal injuries or problems occurs in the non-COVID-19 individuals? I just want to have a brief introduction on that. So, because of this non-COVID-19, because of the lockdown, we have got into a new normal. So, the most of the educations as well as office goes to the home. Online education, online offices with live videos, live meeting, live discussion happening, and is carried out in the virtual environment through existing computer technology. As like I am taking a webinar from India, and you are watching it in various parts of the world. So all this online education has started as one of the important rise of technology in the COVID-19, and this is becoming new normal. Because of this online obtaining to the online education, we are obtaining for a prolonged sitting postures, abdominal cause of the musculoskeletal system, and exacerbator of existing symptoms. A patient with a back pain, because of prolonged sitting, his back pain was increased. Patient with the neck pain, because of forward head posture, his problem was increased. So this was aggravated, or the patients with the new patient has got increase of the symptoms or new arising of the symptoms. What are the common musculoskeletal problems? Because of problems occurs because of poor posture. Because in the office or in the school environment, the children or the office worker are able to maintain a good posture, but in the home there was not able to maintain. So when I am taking this class now, around 50% of the individuals was not maintaining their appropriate posture. There is no erect posture sitting by the individuals who are attending this seminar. 50%, I guarantee you. Long working hours. So in the office, usually 9 to 5 is the timing, but because of work from home, the work office hours have become extended office hours, and the breaks was also not there. In the office, we have a break time, but here there's no break time. Inappropriate break time was there. Use of small devices, especially in the children's. Children are forced to use mobiles to watch their classes. So because of the minute or the small font size, the children has to do excessive strain to the eyes, strain to the neck, strain to the head, which causes lot of other musculoskeletal problems. Stress and anxiety, because of working in the home atmosphere, there will be disturbance from the wife, disturbance from the kids, the disturbance from others, which causes lot of stress, anxiety over there. Environment is poor physical condition. We do not have tables, chairs at the home as like as in the office. That is one of the common reason why the people are getting musculoskeletal problems. Usually, these are the common pictorial representation of spoiling our health in sitting in the system without having a proper ergonomic postures. We are not sitting erect. We are not maintaining our shoulders. We are not maintaining our elbows. We are not maintaining the hands. In the house, we just work what however we like, but ultimately these minute abnormal activities may result in various musculoskeletal problems like neck pain. Forward head posture is very common in the children nowadays because of prolonged flexion posture or small monitors like a tab or watching the classes in the mobile phones, which may all tends to bend forward and watch the classes, which results in forward neck postures. Back pain is very common because of poor sitting posture adopted by the persons. Shoulder pain because of abnormal shoulder movement. Wrist and finger pains, elbow pains are very common. So around when nowadays when we are seeing in the outpatient departments, we have more of number of spinal related cases like neck pain, back pain when compared to the peripheral joint cases. There was a study done in Iran, that's Yaz University, They did a study to the faculty members and they identified what are the prevalence of musculoskeletal disorders. And study was published in 2020, and they found that because of COVID pandemic and the faculties are go for online mode of education, they found that back, neck, and knees are very commonly involved, and these back and neck, that is the spinal region, ranks number one in the musculoskeletal disorders, especially in the COVID-19 pandemic. Right. So, before concluding my study, my reviews talk, I just want to have a few words about the musculoskeletal issues in the post-COVID vaccines. So, as we know, the COVID doesn't have any identifiable treatmentive causes, treatmentive solutions. So, the one-year solution, what we are able to know is the COVID vaccines. Although the vaccines are different from the vaccines what we have taken in our childhood, like the vaccines what we have taken for hepatitis B, or the vaccines what we taken for poliomyelitis or the leprosy. All these are live vaccines we have taken, but COVID-19 vaccines are different from the traditional vaccines. They do not have a live vaccines or deactivated viruses. They have a different type of vaccines. So usually what we have in the childhood are all live vaccines, like a polio vaccine. We have a Sabin or Salk live vaccine, or deactivated vaccines we have taken. But here, the vaccines or the piece of laboratory manufactured genetic material, which are called as messenger RNA, mRNA, which is injected. So this mRNA instructs the body cells to manufacture a spike protein that is found on the surface of the coronavirus, which act as antibodies. Right. So far, as I prepared the slides a week before, the WHO has approved only 7 vaccines in the whole world. One is the Moderna, Sinopharm, Pfizer, Sinovac, Janssen, that is by Johnson and Johnson, Covishield, and AstraZeneca. These are the 7 vaccines which are approved by WHO. Usually, post-vaccine swelling or redness occurs in the injection site, right? So that is very common. So sometimes some people may experience all these swelling, redness, or sometimes the systematic reactions like fever, chills, nausea, vomiting, muscle aches, or fatigue in the first dose. Some patient may have got in the second dose. But whatever I spoke to the people, like around 100 people, 99.99 people has got these symptoms in the first dose. Only 1% of the people has got symptoms in the second dose. But I have never seen after taking both doses they don't have symptoms. And with symptomless people I never seen. Any of the symptoms may occur. Right. There was a study was done to find out whether the COVID vaccine may stimulate the rheumatic factors or rheumatoid arthritis. It was not a study. There was an article written in 2020 last month in the rheumatology news. They told that there is a mild flare-up of rheumatic or musculoskeletal disorders in the post-vaccine. So people who has got already the neck pain or a rheumatic factors or ankylosing spondylitis, they have mild flare-up. Their symptoms was little increased, but it is not severe. That was the article which says. Can anyone take vaccines? Right, anyone take vaccines. There was a studies conducted by various universities. Like this study was done by the John Hopkins University. They identified that the vaccine, 2 doses of vaccine is completely safe even for a solid organ transplant individuals. And there was a study which was done by Chui et al. In 2021 in South Korea. And they found that the people with the comorbidities, hypertension, diabetic mellitus, pulmonary complication, so it's very safe after vaccination. That is confidence interval of 95 to 98% was there. So I strongly suggest the vaccine is the only solution for the preventing or managing the COVID-19 virus in the current scenarios. Maybe near future we are able to identify a lot of new drugs to overcome it. Right. So, what are the management as a physiotherapist perspective? As a physiotherapist, what are the management we can do if a patient comes with any pain, or if a patient comes with any pain before COVID, after COVID, how we will manage it? First and foremost is hot fermentation. Hot bath can be advised to the participants or the patients who come and visit you. You can give some hot baths over the painful region for 10 to 15 minutes, which helps to relieve their pain. Active physiotherapy, active range of motion exercises as well as strengthening exercises has to be incorporated to the patients. If there is no equipment available in the home, advise them to use a half liter water bottle or a sandbag, or any weight cuffs. They have made homemade weight cuffs. They have to do some active exercises, aerobic exercises as well as the strengthening exercises are incorporated. At least one day aerobic exercises, one day strengthening exercise has to be incorporated. Sometimes we can also advise home-based activities like gardening, cleaning, because ideal sitting posture is not at all advised. So we can advise the patient to do other type of activity which stimulates, which resembles the aerobic activities. Respiratory exercises are very important, especially in the COVID patients as well as post-COVID patients. Relaxation techniques are much needed, and high nutrition-rich foods are encouraged to take. There was a study conducted in the SARS, that is severe acute respiratory syndrome. As I told you, it was started in 2002. So there was a study done in the 2005. They identified that in a 123 patient, they identified that 6 weeks of progressive aerobic and resistance exercise program consisting of 60 to 90 minutes, which occurred 4 to 5 times per week, could improve strength and function. So the best management, what we are telling, what we can recommend to the patient is not to sit ideal, at least do some exercises, especially the aerobic exercises as well as the strengthening exercises. Before I conclude, I just want to share a video on what is the criteria for calling off the pandemic. This was answered by a WHO director. Kindly increase your volume so that you are able to hear neatly. 1 minute, I will play the
What is
video.
the criteria for calling off the pandemic, and are we close to that point?
If we think about the last pandemic in 2009 of influenza, the predominant strain still transmitting is the virus that caused the pandemic. So I fully expect that this virus will continue to transmit for a very long time. The question is whether it's still causing a public health emergency. And that is determined by how many people it's making severely ill, how many people that virus is killing, and to what extent we've controlled transmission. So we do have a committee at WHO, the Emergency Committee, that declare when a public health emergency of international concern exists. They have met a number of times in the last year and a half, and they continue to say the public health emergency continues to exist. So from my perspective, if we can continue the rollout of vaccines in a more equitable way, if we can keep control on the variants and we can get to very high herd immunity levels and good control measures, then if we can bring the death and the hospitalizations and the tragedy of this pandemic, if we can bring that to an end and we can keep transmission to a very low level, then I consider the pandemic to be over as a public health emergency. But will this virus disappear? No. That's the reality.
What is the criteria?
That's the reality. See here, the virus will go down. So how we are overcoming the virus? Only by SMS. Like you have to make a habit, sanitize yourself whenever you go outside. Whenever you come home, please sanitize your hands very well. Put a mask. Wear a strong mask, not a cloth mask. You are supposed to wear a surgical mask or N95 mask, and maintain a social distance of 6 feet. At least, though your friend or your relationship is there, you are meeting a new person, please maintain a 6 feet of distance. In addition to that, vaccine is very, very important. I suggest to take vaccines because, as the WHO director told, because when a lot of people are taking vaccines, then there's a chance of increase of herd immunity. When the herd immunity is there, then we are able to overcome this virus. But the virus will be exist. As the WHO also told that there's some part of the world will get coronaviruses, corona infections will be there at least 2 to 3 years from now on. So these are my references. I would like to say big thanks to the MAHSA University, the organizers, and the Associate Professor Kaman and Sasi Ganesh and the other faculties, my friends and dear students, and thank you for giving me an opportunity. And I'm open to any questions, kindly share. So stop sharing.
Thank you, Dr. Arun, for the insightful presentation. It reminds me of the lecture you did for me in the year 2001. It's about 20 years before. You still have the same kind of putting the knowledge to the students. Thank you. It was very clear and understandable for everyone. Thank you so much. Dear viewers, if you have any question for Dr. Arun, please leave a comment in the text box. Dr. Arun, there is a question from Muhammad Al Kauthar. Thank you for the informative sharing session, Dr. Arun. May I know how common is the musculoskeletal involvement in post-COVID population?
Yeah, as per the literature, it says 25% of the population may have experienced musculoskeletal problems, like spinal problems. As I told you, spinal problem is a common problem. Back pain, neck pain are very common, and in some conditions, some individuals post-COVID they have got lot of muscle weakness. That is, sarcopenia is commonly seen, especially in the quadriceps muscle as well as in the upper limb muscles, especially in the hand muscles we got weakened. So as a therapist, we are supposed to do strengthening exercises to the quadriceps as well as the hand exercises over there. But spinal cord, the spinal pain, neck pain, and back pain are very common in post-COVID populations. And fatigue is very, very common. Even a patient was not able to walk for 100 meters, they feel very fatigued. Still, we are getting a lot of patients in our outpatient department. Post-COVID patients, we have post-COVID rehabilitation also. The patients who are always before they say that before COVID they are absolutely normal, but post-COVID they are not able to walk for 10 meters. They have got lot of dyspnea and they have got lot of weakness. They say that it is very tired. I was not able to walk even for 10 meters, 15 meters. Especially patient who has got comorbidities like diabetes, hypertension, this is double the symptoms. Although there was no literature support for that, but what we saw in the practical is these patients, their problems are much double, much more.
Thank you, Dr. Arun. Very clear answer for the question. There is a question from Mr. Rahul Krishnan. How physiotherapy can help people living with post-COVID syndrome?
The physiotherapy is very, very important in post-COVID syndrome because we are giving lot of respiratory programs to improve the strengthen the muscles, thoracic mobility exercises we are giving. We are giving upper limb and lower limb assisted exercises as well as aerobic exercises, which are very, very important in these patients because the patient may got fatigues, the patient may got respiratory illness, the patient may have the muscle weakness also. So the resistance training is very important, and the whole physiotherapy is important. Like I cannot say that we can give only the chest physiotherapy, we can give only the upper limb exercises. It is not like that for the post-COVID patients. The post-COVID patients needs a total body rehabilitation. You have to give upper limb exercises, give lower limb exercises. You have to give concentrate on the respiratory exercises also. So yeah, there was no single treatment which we can advise. The whole body treatment only we are supposed to go. And there are tailor-made exercises. There was no common protocols. Although there was so many protocols, which the guidelines are also there in the WHO also given guidelines. There's some many countries there also European guidelines are there, American guidelines are there. In India there are AIMS guidelines are there we are following, but still the protocols are different from individual to individual. Some patient was able to achieve some limit, some patient was not able to achieve it. We have to design on the individual's model. If it is a younger patient, we can push them harder. If it's an older patient, we have to reduce the exercises. Same as the repetitions, the frequencies, everything has to be reduced. So the
Thank,
exercises it's mandatory. Physiotherapy is mandatory in post-COVID patients.
yes. Thank you, sir. Thank you. There is a question from Madam Sonia. Dr. Arun, how much COVID is responsible for the chronic pain flare-up?
Yeah, the study shows that rheumatological conditions are getting flared up. There was a study that I showed in the PowerPoint also. The study was done by Pakistani. They say that it was a case study only, so there was no extensive literature done on that. But what happens is the doctor has identified that his patients, that is 6 rheumatoid arthritic patients, their condition was flared up, that is increased following a COVID-19 virus. So he said that it is a culprit for creating lot of inflammatory diseases in the knee joint as well as in the arthritic conditions. So, but still there was extensive literatures are done here, and when maybe this is a preliminary research because the COVID-19 has come like last year only. Probably after 2 3 years when there was extensive literatures come up, the publications was made, we are able to understand how much amount of COVID flare-up or the pain flare-up we are able to identify. But so far, as per the case studies, there was a flare-up is there, the rheumatoid patients. And as we saw in the outpatient department, because of COVID-19, we have seen a lot of muscle wasting is there. That is common. It may be because of osteoarthritis comes with a muscle weakness, or maybe because of COVID causes stimulating the OA and may results in muscle weakness also.
Yes.
We do not identify the relationship, but we have certainly we say that the patient have muscle weakness following COVID. Maybe because of it, COVID may stimulate the OA. That relationship we need to identify. Maybe studies may come up in the near future. Thank you, Dr. Sonia.
Thank you, sir. Thank you, Madam Sonia, for the question. There is a question from Ms. Jiva Lawrence. Does the age factor play a role in the post-COVID myalgia, sarcopenia? If so, how it works?
Yeah, certainly age factor is there because as we saw in the literatures, patient with the comorbidities may have more sarcopenia, more myalgia, whereas patient with younger age group doesn't have that much of myalgia, whereas the patients who are older has got lot of myalgia, and the elderly population may got cachexia, that is 5% of cachexia are commonly seen in the elderly populations, and the population with the comorbidities, that is diabetic hypertension, they have got cachexia. But in the elderly populations, there was they are able to overcome it. There was not obvious muscle weakness seen in the younger populations, but elderly populations only all these muscle weakness were identified. As I told you, this literature still we are in the budding stage of understanding the COVID-19 related to the musculoskeletal conditions. Probably in near future we'll get a lot of literatures on that, and we'll come up with a lot of new information regarding that. It
Yes,
was
sir.
nice. Thank you, Jiva.
Exactly. Thank you, Dr. Arun. Thank you, Jiva. There is one more question from Madam Bhanumati. Are there any specific precautions to be taken when giving physio for post-COVID patients?
Yes, sir. Yes. Yeah. Obviously, we are supposed to uh, identify every individual before giving a rehabilitation. As I told you before, there was no hard and fast rules in rehabilitation one, and there was no straight rehabilitation. Every patient is a single patient and has to be assessed and has to be given a tailor-made protocols. There is no straight protocol for all the patients. We cannot give one exercise chart and give it to all the patients. Every individual patient has to be treated separately because we saw that my patient comes with only lower limb weakness. We saw the patient comes with overall fatigue. We have a patient comes with over myalgia. So all these three group of patients have a post-COVID conditions. But so all these three patients needs three different therapies. Only quadriceps weakness, we are focused only on the lower limbs. The patients with the cold myalgia, we have given IRR or heat therapy along with the exercises. Our patient comes with only fatigue, then we have to start giving lot of this active exercises, aerobic exercises are started. So every patient is different, and especially in the COVID-19, we cannot follow a general guidelines. Every patient is different, and we have to need a tailor-made protocol for each and every patient. Thank you.
Thank you, Dr. Arun, for answering the questions from the audience. We have come to the end of today's session. Thank you, Dr. Arun, for joining us today and providing such an insightful information. We really appreciate your time with us. Really thank you from the School of Physiotherapy and the Faculty of Health Sciences. To our wonderful audience, thank you for joining us at this webinar. We look forward to your comments and participation at future events hosted by MAHSA University. In case if any further information, dear viewers, you can contact us through MAHSA website or visit our social media pages. Have a pleasant evening. Thank you.
Thank you.